Thanks, Griff. Doctors have to get back to work too, and medical workers say lockdown orders are delaying patient needs from cancer treatments to dental visits. Let's bring in our medical panel, neurosurgeon Simon Moore, Fox News contributor Dr. Marty McCary, and dermatologist Jeanine Downie. All of you, please welcome to the show. I'm so glad to have you here today. This is a very important topic that I'm very passionate about. Dr. Downie, I want to start with you because you had a soft reopen on May 13th, as far as I can see. And I just want to ask you if you're concerned about the fact that many people who have conditions not related to coronavirus at all haven't been able to get in to see their doctors. They've been trying, and telemedicine has not been adequate for those services. So are you worried?
Absolutely. Good morning, Jedediah. Thank you very much for having me on. This is an important topic. I am concerned. There is a hidden pandemic out there of untreated conditions. So many patients that can't go to the doctor, our goal should be to keep people out of the ER and out of urgent care centers. So there's all these different conditions that are treatable and preventable in the doctor's office. And without us, there's an increase in heart attacks, there's an increase in strokes. Me particularly, there's an increase in skin cancers, aneurysms, kidney failures, and so many of these things are preventable. And so there's downstream health effects of keeping doctors' offices closed. And I, as a board-certified dermatologist, am very concerned about that, 100%.
Dr. McCary, I want to ask you about this tweet from Governor Cuomo on May 13th. It reads, "Reminder, doctors' offices are essential businesses and continue to be open to patients across New York State. Check with your doctor for hours and protocols." I live in New York. That has been untrue. I could not get my baby in to a dermatologist in person for a rash that was concerning. I myself had a non-COVID related issue long after I was I had tested negative for COVID. After testing positive, I was, completely recovered, and I couldn't get in. So he's not being truthful. So what do we do about that? The fact that this misinformation is out there and doctors' offices just aren't accessible to people the way they should be.
Well, Jed, good morning. It turns out there's a big backlog of cases, and it's from this time when we had the shutdown. So, look, every doctor's office is different, and I think most doctors are ready to get back to work, and most doctors' offices should be able to open, with the exception of maybe some pockets of the country. Montgomery, Alabama has had a recent outbreak. But for most of the country, some of the early draconian moves that we did made sense then, but right now we need to evolve our strategy.
Dr. Moore, I want to ask you also just about the mental health component of this, because I can tell you I've been on the phone with people all day long, oftentimes, with them struggling with the fact that they can't see a doctor or the fact that they can't get into an office is putting an enormous toll on them. So at what point does it become prioritized that patients need to be able to be seen, as opposed to the fact that, this is coronavirus 24/7, and people need to understand there's other stuff going on that needs to be addressed. So at what point does that come into play?
Excellent point, Jed. Good morning and happy to be on. You're absolutely right. I think the key thing here is we need to balance patient safety, but also patients' comfort, fears, and the logistics of social distancing while providing timely care. And one of the things we've realized is that patients are not educated enough. So we have implemented a full suite of telehealth where patients can upload their radiological images, can view a physician face-to-face, and that seems to be reassuring to them more so than the phone. But more importantly, right now, our big step is we're trying to educate patients on the fact that they can get in to see us for those patients that need to. We've spent a lot of logistical research and time to open up, everything from Midtown Manhattan to Westchester, but we're doing it in a way where patients don't have to spend a prolonged period of time in the waiting room at all. But as far as a mental health issue, absolutely. As you know, there have been spikes in suicide hotline calls, so on and so forth. So I think education's a big issue, but also reassuring patients that, let's say, need surgery. Well, if they become educated, we can reassure them. For example, all of our surgical patients get tested for COVID-19 and must be negative 2 days in advance. We are offering COVID-19 testing to all physicians as well for antigen testing.
With no disrespect, I just have to interrupt and say, though, I can tell you that there may be some offices, and maybe you're one of them, that is making exceptions and saying, you know what, if you need to be seen, we will see you. But I encountered many, and I still can't find some doctors that will see me for certain things. And I have friends as well going through the same thing. And also, some of the testing is delayed. Like, they'll say, well, we're not going to do these kinds of tests until September because of the COVID risk. And my response to them is always, well, what about the non-COVID related risks of not doing that testing? So I think everyone needs to be on the same page that COVID is important and that needs to be addressed, and there are safety protocols that can be put in place, but non-COVID related issues are also important, and they can't always be second, because sometimes those issues may have an even more significant impact. So I want to thank you all for being here. I really appreciate it. This is obviously an issue that we're going to keep facing. Yes.
Really quickly, povidone iodine swabbed up the nose. It's not a cure, but it dramatically decreases the viral spread. And so we doctors are doing it, surgeons are doing it, absolutely critical. Decreases the viral spread, but not a cure. That's betadine.
If anyone is capable of providing that safe environment where people should be able to be seen, you guys are it. We trust you more than anyone. So I want to thank you so much. I could talk about this for an hour. Unfortunately, we don't have that time, but I so much appreciate your input today. Thank you so much.